us.
Oh, she will.
You think?
Oh, yeah. She does have a sense of humor. It's buried in there deeply.
I have a sense of humor, too. That's wwhy the commercials are done, and we are on.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212. Or text 23680.
Is she yelling at us?
Yes.
I feel like I'm being yelled at.
That was Linda yelling at us.
It was Linda yelling at us. Hi, everybody. How are you? Welcome to the show. Wait, here's that catchy music we like. There it is.
Now we're officially on.
Whee! All right, that's Dr. David Klein. I am Melissa Fox. How are you, everybody? Okay, so today, as usual, we'll start out the show with Dr. Dave laying out a little something for you to chew on, so to speak. And then we'll take your calls, questions, etc., and answer texts both on the social media at Stages of Life Medical Institute, as well as on the phone, 407-422-1212. Text line's always open, 23680. So, today, Dr. Klein has decided to talk about the male libido. Well, not really.
Not so much the libido.
More like the hormonal balance.
Yeah, well, it's going to be, we spent a lot of time on women. We've spent a lot of time on all kinds of different things, but we've neglected the guys just a little bit too long.
Okay.
So I figured, well, all right, fine, I'll agree to go ahead and discuss what we need to do here. And what we're going to talk about is hormone balance, hormone replacement, hormone considerations in men. You know, when we talk about hormone replacement therapy, generally speaking, the implications in most circles that you're talking about women. Well, we need to do BHRT, bioidentical hormone replacement therapy, tick, and it's always about women. And what do we do about guys? How do we handle guys? And you're going to think, well, gee, it's different. You know, they'll get those shots of testosterone and they're good to go. Well, in fact, it's not that simple. B, what's been going on with men's testosterone replacement is criminal, in my opinion, just in terms of the damage that's being done. So what's the difference between people? Why is it that some people need testosterone replaced and some do not? Men. We'll limit it to men right now. And the answer is because men age at different rates. There are things that we do in the environment. There are things that we do medically. There are things that we do socially that can reduce testosterone secretion and sometimes do it irreversibly. And it happens slowly. It's an insidious process. You don't even necessarily know that it's going on until you lose your edge. Or there's that competitive moment, that third date, whatever it happens to be, when things have to gel and they don't. And then what do? It's kind of an embarrassing sort of a situation. They have all kinds of really cool commercials on the air. You know, some of them are very funny. Some of them are kind of sad. But the fact of the matter is that men age at different rates every bit the same as women, except that women, there's not necessarily any external visualization that things are not working. They can fake it. It works just fine. Men have a much more difficult time with that. So what are the sorts of things? Well, how do people age? So with women, their hormones, you know, we're going to limit it to estrogen, estrogens, estriol, estradiol, estrone, testosterone, and progesterone, DHE, androstenedione. And with women, they all decrease simultaneously. It's kind of cool. Makes it real easy. You hit about 35, 36 years of age, and then all of a sudden the hormones start to taper downward. It's just what you can expect. People find themselves with a little sagging here and a little sagging there. They may find that their hair is changing color, their skin is changing. All kinds of things are changing. With men, on the other hand, their testosterone does in fact decrease 2% per year beginning around the age of 20 to 25, and it just keeps going. But something else happens. That's estrogen goes up. At the age of 40, the average man has a higher estrogen level than the average woman of the same age. That's insane when you think about it. That's just about the time that peak divorces occur. Okay, why? Because the guys tend to become less manly in many ways and a little bit too much like their wife. So, you know, it's just like anything else. Opposites don't necessarily attract, although we can argue that out in a different venue.
Sure, but not here.
Not here, not today. No. So what is it that we have to do with men? So you're looking at a very different picture. With women, you want to increase their progesterone, increase their testosterone, increase their estradiol. all of them. But with men, it doesn't work that way. You have to increase their testosterone while at the same time decreasing estradiol. Otherwise, you end up with man boobs. You end up with a bunch of other problems, none of which are all that good.
No.
So how do you do this? And this is where it starts to get very interesting. We have 1950s technology, which is still being done to this day. The anachronism of it all. It's easy. You go to your doctor. They give you a little vial to keep in your refrigerator. You have some sadistic family member that's going to inject you in the tail with this once a week. And my God, things are glorious for a day or two. And then the rest of the week, you're back to your old whiny self. So for men and women, it's we all have the same degradations with age. They just manifest a little bit differently. DHEA is something that people like to talk about. They like to think that they read something important on WebMD. But it does, in fact, drop with age. It's called the Fountain of Youth hormone. But you never take this over-the-counter product without doing blood work to support the levels that you're taking, because it can, in fact, become a dangerous sort of a thing. It's illegal in Europe, actually. Kind of neat. So testosterone levels drop, and that's what we're going to talk about pretty much in men today. So is the approach to diagnosis different in men and women? You're going to think about it and say, well, it would have to be. But the answer is it's not. It's exactly the same. We're all made of the same bricks and mortars. The difference is ratios. The difference is amount. So the average gal, should have a testosterone level between 50 and 80. Now, they define normal as 5 to 45. Normal in an abnormal population is not a good thing. So you want it to be a little bit rich, otherwise you develop the same osteoporosis that your neighbor has across the street. So you need to maintain a level that's actually more normal for a 30-year-old, not normal for a 60 or 70-year-old. So how do you make the diagnosis of these problems? Just clinically, somebody walking through the door. Well, first thing is history. People will tell you what's wrong with them if you listen well enough. If you listen to the patients, they will tell you what is wrong. Not necessarily specifically, but metaphorically they do. The physical complaints will tell you a great deal. What's dry, what's wet, what's hurting, what's itching, what's weak, what's strong. There are many of these things, and that's what a good history will tell you. Certainly not something that you're likely to get, on one of these computer programs. Well, I'm going to type in my symptoms, I'm going to get out a diagnosis. God knows, if it were that simple, you wouldn't need medical school. The fact of the matter is that it makes most doctors much busier than they otherwise would be. Just like the package inserts for the medications. When those things started being given to people, the docs pretty much by and large thought that it was going to cause a rush on, what ifs and miserable calls. What it really did was it made us all busier. Didn't it put our kids through college? Why? Because people were, reading these things, developing all the same symptoms that they didn't have. So we'd have to change the medicines 15 times from Sunday, all unnecessarily as it seems. But the medication history is probably the single most important thing that we look at, because when it comes to hormone replacement therapy, about 60% of the patients that I see on a daily basis are self-induced hormone imbalance situations. You exclude the folks in the 60s and 70s and 80s. But if you're looking at folks in the 30s, 40s, and 50s, it's almost always medicine-related. Things that you were prescribed or things that you're taking over the counter. Medications that may not even make any sense to you. Things like Ritalin and Adderall shut down testosterone like a champ. Shut down cortisol like a marvel. Causes all kinds of problems. Flonase, these little nasal sprays, shut down the gonadotropins like it's like dropping a rock.
Wait, Flonase makes things not work?
You got it. Yeah, I know. That's stuff that you're using right now. So how do you figure this out? And the answer is very simple. It really is easy. And it's done with blood work, not saliva testing. For those of you out there that like to spit into vials, that's pretty useless. So waste your money. Give it away. Give the money away to the guy under the bridge, because you'll get more satisfaction. But you want blood work to look at it. And we'll talk about the rest of it after these very, very important announcements.
Very much so. Please support our sponsors like Pharmacy Specialists over there in Maitland, the #1 compounding pharmacy that Dr. Dave lives by.
You betcha. Good guys. I've known them for 30 years.
There you go. All right, so we're going to talk a little bit more about male testosterone replacement and supplementation when we come back. This is Stages of Life Radio on News Radio WFLA Orlando. Sorry about that.
Oh.
That's great. Hi, everybody. That's yummy. All right.
Now, that was just actually, that was acting school 101. How do you make yourself cry and how do you make yourself cough?
Oh, that was it. Just grab some high hairs.
There you go.
Well, I wasn't lying that I didn't, I feel fine.
You just look like heck.
I'm burning up.
How are you sleeping?
Not well.
Yeah. This kind of cough will keep you from sleeping.
Yeah, I got a heating pad going. It's only just dropped into my lungs.
Do you have any peppermint oil around the house?
Yes.
Okay. Have you been using it?
No.
What is wrong with you?
How do I use it?
Okay. What you do is, if anybody's listening, God bless you.
They
okay.
are. Thanks for being
there. But you're listening right now.
Hi,
so
guys.
what you want to do is to wash your hands. The single most important step of this is to wash your hands with soap and water.
Okay.
You take your peppermint oil in your left hand and you take it and tap a couple drops off under your right thumb. Stick the right thumb to the roof of your mouth. Hold it for a moment, take it out and repeat. What you're doing is you're putting the peppermint oil on the hard palate. Within moments, it'll go through into the maxillary sinus, stimulate it, and you're going to want to blow it out.
Okay.
It is kind of like a shooter for the maxillary sinus. It knocks it out of the park. So how often do you want to do this? About as long as you want to. You can do this 5 or 6, 10 times a day if you chose to. You will, in fact, smell like a peppermint candy, but that's okay.
Will I?
You will. You'll like it.
Hold on, I messed up.
Peppermint candy, but you really want is peppermint oil. It works.
My nose is running.
There you go. That would be done if you'd used it.
Really?
Yeah.
Well, I don't have Tylenol in the other room right now.
I didn't say you had time.
He's being mean.
I am being mean.
He's being mean unto me.
Okay.
Seriously.
So picking things up. Okay, so that way I'll have time for calls today.
Right.
Okay, is how do you establish this diagnosis? We talked about the history, the physical, the response to medications, positive and negative. Medication history is the single most important thing, and you never seem to get it right on the first visit.
30 seconds.
I didn't think that was important.
So
But you treat by measurement. You treat by blood work.
Gotta wait.
So what do you
wait.
do?
You're gonna wait 20 seconds.
Oh.
I don't want you to waste all this on just the.
Oh, I thought we were on.
No, I
even
said I
worse.
hit something here.
Oh, you hit something funny.
Yeah.
Got it.
I pushed the button.
I misread you.
No, it's because I'm a little under.
You have a cold.
I'm a cold. I gotta go to my nose, so is it gonna go?
I don't know. Live radio. Gotta love live
Very
radio.
nice. You do. I love live
Yeah.
radio. Fly by the seat of my pants radio.
Well, it's out there with no net. You're high wire with no net.
Yep. There I go. Yes, okay. So, welcome back to Stages of Life Radio. We are definitely live. Dr. David Klein in his chair, talking about the male hormone balances when we left off. We were talking about how you would diagnose if there's a problem, and you said blood work, not spitting into a
Not
tube.
spitting into a tube.
Okay.
There are people out there that really love the idea of doing things without a doctor's order. So they're willing to spend even more than they normally would because they think that they're spending less by being smart to get salivary hormone levels, when in fact that is one of the goofiest things in the world to do. It's one of the very few things that the FDA has actually told the insurance companies they will not pay for it. Medicare will not pay for it. They'll pay for urine hormone levels. They'll pay for earwax. They will pay for everything but saliva because it's never been shown to work. So what do you do? Okay, history, physical complaints, response to medications, but the blood work is what the key is all about. So what you do is you go ahead and you draw blood on the individuals, looking for things like testosterone. You can get free testosterone also. I prefer total testosterone. Estradiol, wickedly important men and women. Progesterone, same thing. DHEA, very, very important because that's like a sinkhole with regards to the precursors for testosterone. If you have a little extra dough, or if you're covered by Medicare, you're going to want to go ahead and get cortisol, thyroid as well, because these things all influence the rate with which testosterone is produced. So once you have your amount, you can decide what you need to do. So if somebody comes in and their testosterone is low, let's say it's in the 250s, 300s, and they're 50 years old, it should be a little closer to 550 to 600 for them to feel right, think right, perform. So you go ahead and you start talking to them about using transdermal testosterone, not intramuscular and not the pellets.
Okay, so that's stuff that you actually mush into your, say, wrist area?
No, you put it in, it's called the volar aspect of the forearms. So it's the part of it's the soft, thin skin between your wrist and your elbow, the inner portion of your elbow.
Oh.
So there's no fat in there, and that's key to this business because fat is biologically active with regards to converting testosterone to estradiol. So you want to put it someplace where there's minimal fat. That means no thighs, tush, tummy, or any place that begins with a T. So what is it all about? You apply it in the morning because the testosterone level should be, starts to increase and hits its peak between 3 and 6 in the morning. I prefer people not wake themselves up to put it on. So you wake up, you shower, put the goo on, and away you go. When you do shots, if you do it once a week, you end up with 2 to 3 days of peak testosterone levels, and then it trashes. It drops like a rock. But the body uses the excess testosterone to produce estradiol, and then things start to go sideways after 3 to 6 months. Sometimes it's irreversible. With the pellets, you end up with a steady testosterone level, but the body is expecting to see it come and go in waves, kind of like the tides. So if you did away with the tides, the weather patterns would change terribly. We would see global God knows what. Who knows what happens to a man or a woman, for that matter, that gets pellets put in and you don't see the tides. Ugh. It is a problem. So what do? You apply the goo, you wait 90 days, retest it, and then adjust your dosage. So what do you do about a guy, who has a low testosterone and a high estradiol? You give them more testosterone. Did you know that testosterone degrades to estradiol? That's the pathway to dihydrotestosterone and estradiol. So if you don't block the degradation of testosterone to estradiol or dihydrotestosterone, you're really just kind of peeing in the wind. It doesn't make a lot of sense. So you need to use aromatase inhibitors and something called 5-alpha reductase inhibitors. No, you will not be tested on this, but I will teach you how you fix this. And it's easy. So with the transdermal testosterone, the way I prefer to have it compounded is it's made with a little bit of progesterone and something called chrysin. So this blocks the degradation of testosterone to estradiol, making it more potent and let's say less problematic, and chrysin, which makes things work better. So that combination really does well. You can't get it commercially, so it has to be compounded. So the fun part about this is it's actually less expensive than the commercially available products. Your insurance companies don't cover them either, so you're not really losing anything. The little bottles of testosterone are for folks that don't know any better and VA patients. So what do you want to do? What types of supplements do you look at? Because you can, in fact, control things with over-the-counter products. In spite of the fact that Bob is smiling, sometimes these things actually work.
Why is Bob smiling?
Why is Bob smiling?
He's making a lot of money off you.
Bob made a lot of money off you and then ran. You haven't seen too much of that stuff recently, have you? So, but what supplements work? I've been in this business for 40 years. I'm still here. Bob is smiling, and he's somewhere in the Bahamas. So we have one called Stud Mix, and what does it do? If you read the label, it's got all of the ingredients, no proprietary blend of this, that, or the other, so you can not know what you're getting. But what it does is an aromatase and a 5-alpha reductase inhibitor, and then a little something called poor man's Viagra, just in case you need a little extra kick down below. Stuff is inexpensive, and it works. Take it every night at bedtime. So the trick is to treat the underlying testosterone deficiency. Try to time it exactly right. You get as close to natural as you can, which means 6:30 or 7 in the morning. You wake up, shower, and put it on. And then you go about your business with your diet. Now, what do you do if you have high estrogen levels? We find this on a routine basis. A guy will come in with an estrogen level in the 40s, 50s, 60s, or higher. Now, those would be good levels for a woman. Not so great for a guy if he's expecting to perform like a guy. So you either block the production, which you can do with the chrysin in the cream, but more appropriately what you can take is something called Deindole Methane. The product that we use is called nomowining. And it's taken orally, and it blocks the degradation of the estradiol by blocking its degradation from testosterone. So if it's a seesaw, it tilts it to the testosterone and away from the estradiol. What else can you do? So if you are blocking the production, you can increase excretion. The body is good at this. So if you have the means and mechanisms to clean it out quickly, doesn't it make sense to do it? So how do you do this? Oddly enough, it's really very simple. You can use something called milk thistle or silymarin. Now, women, you have to be really careful with it because
Milk thistle, right?
milk thistle. When a woman takes milk thistle, it will lower her estrogen very, very quickly and far too profoundly. Men, it's a little harder to get it down, but once you do, it works beautifully. So the combination of silymarin and curcumin is what I prefer to use. Why? Because it's cheaper than just the silymarin alone. But the curcumin also helps men, and 1/3 of whom have subacute prostatitis. So it helps with that, settles it down, and makes them do a little bit better. You have to be careful with your medications. You need to be taking medicines that will support your thyroid and adrenals. So what does that? And the answer is very simple. B-complex vitamins along with the micronutrients of a mineral nature. So we use magic minerals, and it works fine for this. So silymarin, curcumin, how does that work? And it's kind of cool. What it does is it makes you take it from the outside. So specifics of treatment. 1, testosterone combined with natural aromatase inhibitors, one of which is progesterone, the other one's called chrysin. Natural aromatase inhibitors taken orally, Dr. Dave Stud mix. Silymarin, curcumin. What that does is it increases excretion. Insoluble dietary fiber, you can get this in your diet. It works just fine. If you have to take a capsule, we have those too. And wouldn't you know it, you too can start to perform again. It's really pretty simple. Love it. And then DHEA. Now, people are saying, well, what about DHEA? He didn't mention DHEA, did he? DHEA is, in fact, an androgen. Okay, sure enough, but you don't take it unless you need it in terms of your levels. Otherwise, it makes everything go sideways. So, how much does it usually take? With women, it's anywhere from 5 to 25 milligrams. Men, it can be as little as 10, but usually 25 to 50 milligrams. On occasion, it's a little bit more. But it is gender specific, believe it or not.
Right. Well, look at this. Okay, Dave Stud Mix, no more whining, magic minerals, silymarin, curcumin mix, and DHEA.
Yeah. It's not that much, actually.
Nope.
You're talking. It works out to about $40 a month.
That's not bad. It
No,
keeps
it's
things
not.
working.
And then the testosterone. People say, well, that sounds like a lot of money. Blah, blah, blah. No, it actually works out to about $28 a month.
Well, that's not bad at all. See, very nice.
The pharmacy has been very generous to our patients.
Did you learn something, folks? Did you? Huh?
For the moment.
Okay, good. When we come back, we got a lot of questions all ready to handle here.
Right.
And
Well,
we
I'm
got
ready to answer
people
them.
hanging on the phone. So 23680 is the text line. If you want to just go ahead and ask your question, give us enough information to, field it.
Yeah, there you go.
That always helps.
Hi, I'm 22 years old, and I think I'm 80. I love those.
That's a good one. Yeah, 407-422-1212. That is the phone number to call in. We'll be right back at Stages of Life Radio on News Radio WFLA Orlando.
Good stuff.
My nose is running. Sorry.
She got a cold in her nose.
I got a cold in my nose.
A cold in her nose.
Well, actually, yesterday or Thursday when it started, I knew it was yellow. I made it yellow color. Came out one side, and I was like, God dang it.
Yeah, you have a cold in your
I have
nose.
a cold in my nose.
If you use the mucus relief, which you
I
have,
have,
okay,
sitting right on my
keeps it
counter.
nice and fluid, so it will come out. As long as it comes out, it will not get infected.
Good.
All right, and the trick
I
is,
know that. Trust me,
yeah,
I
that's the
know
real
that.
trick. Is getting it infected never works. You have to give somebody an antibiotic. That sucks.
Yeah.
Changes the gut flora, and then you have to treat that. It's kind of an interesting treadmill that you put yourself on.
I didn't do it.
Gerbil wheel. Once you get started on it,
Well, I went to
an annuity for the doctors.
You know what happens? I went to the clinic.
Oh, did you?
Yeah.
Oh, good.
That was it. Wasn't anybody there but germs. No, I went out to a dinner party with a young child in tow.
Oh, really?
Yep, that'll do it every time.
Oh no!
Yep.
How did you get wheedled into that?
It was like a birthday/family dinner
Oh,
thing, and
really?
yeah, I got wheedled into it.
Oh, that'll do it. Ask any kindergarten, elementary school teacher how much fun it is the first couple of years.
And I
They're-
knew.
Oh yeah.
I knew it. I was like, oh, I know I'm gonna, and I'm like, don't buy into it. You're not gonna get sick of it. Yep,
Yeah,
sure.
right.
Every time I'm around different people than I usually am. Yep.
Here,
somebody-
hold Junior.
All right. Here,
All over
here,
you.
right? Hold my hand while we walk across the street. That was it.
There you go. Tag. Last tag.
Yum. Anyway, it fell into my chest yesterday, but I woke up and I was like, now it's in my chest. Great. So anyway, enough about
You got
me.
3 days of fun.
I know, I'll be all right.
Well, you gotta be yourself by Friday.
Now, why is that saved? I still mess up? No, I'll be all right. I'll be all right well before Friday.
Yeah.
How is it I mess this up every time? I honestly cannot do math, apparently, while I'm not.
Hey, you got me coughing.
Stop! You're not allowed to. And you're just coughing for sympathy, aren't you?
It's a sympathy cough. I'm a very empathic kind of guy.
I'm gonna try to make it good again. I might have blown it. It might be the end of it. We might not ever see it again.
No.
Yeah.
We'll have to talk to Linda about putting one together.
Yeah, that might be it. 9, 8, 7. How you guys doing out there? I know I got a question about endometriosis. Yep.
Well, when a guy gets endometriosis, that's a problem.
Welcome back to Stages of Life Medical Institute show called Stages of Life Radio with Dr. David Klein. I am Melissa Fox, and I'm glad you didn't hear that. Right?
No.
Yeah, that was just cuckoo. Now, we have some questions we need to get to here. We got some phone calls. All right. Here's the text line. Hi, Melissa. Can you see if Dr. Klein can discuss VAERS? VAERS?
VAERS? I'm
Yeah.
not familiar with the acronym.
And also myocarditis
Myocarditis, yes.
in young men after corona injections.
Okay. Well, one of the problems that we're seeing is, a rare incident called endocarditis or myocarditis. That's inflammation of the heart following these injections. Is it a big deal? The answer is no. Nobody's really gotten particularly sick from it.
Oh, VAERS is Vaccine Adverse Event Reporting System.
Okay, marvelous. Okay, yeah, and I've actually participated with those. People come in, I'm complaining of nausea, you type it in. It's just the way it goes. In fact, most of the people are doing it themselves when they start getting these requests for information from the Department of Health or from the CDC. They come on your telephone. How are you feeling? Any questions? Have you had any problems at all? So with regards to the myocarditis, it really isn't that big a deal. But I want you to understand this. Okay, what happens when you get the inoculation is that a certain number of mast cells eat the vaccine. That's all. It doesn't make it any further than your deltoid. That's the muscle in your arm. So the mast cells eat it. They start to develop these little zits that look like those coronavirus outpockets, the little attachment proteins, and then they in turn get eaten, and the immunoglobulins, the gamma globulin G, start to go up. But when you get the disease itself, you have trillions more times of the same protein. I mean, you get hammered. That's why people end up in the intensive care unit. That's why people die of cardiac failure, respiratory failure, is because they get so much of this very same protein that they go down. So the risks of getting the disease, so 1% fatality. If you're in certain age groups, the percentages go up. With regards to stroke and heart attack following the disease, it's very, very high. But the myocarditis from the vaccine is not that big a deal at all. It'd be like complaining of muscle aching from influenza vaccine. Okay, good. So you ached from the interferon reaction that you get from the flu vaccine. So you have to weigh the risks. Weigh the risks. If you're going to drive your car from here to, let's just say, North Carolina to go on vacation, there is a finite risk you are going to die on the road.
Oh.
And yet you take that risk all the time. If you're going to go out in the sunny state of Florida and play golf, there's a finite risk. You're going to get struck by lightning.
Could happen.
You want to go to New Smyrna? If you're from out of town, New Smyrna is a really cool beach, just north of here. Okay, people get bitten by sharks there, it seems, on a weekly basis.
Yeah, right now at the docks. Whoops.
Right. It's like, oh, well, there they go. So the fact is that we take these risks all the time. You weigh the risk. Is it worth the risk of dying on the road, dying in an airplane, dying going out to dinner, okay, than it is to enjoy something else? You make that decision. Well, I made the decision that it makes a lot more sense to take the vaccine if there's a remote risk of some allergic reaction, which, by the way, never happens, or in this case, myocarditis, which I've seen in my office. Okay, it goes away.
Yeah.
Big deal. Okay, but when you die, it doesn't go away. You go away.
You go.
Okay, so it's better to be seen than viewed. That is a profound medical recommendation from you.
That's a good one. We got Jerry on the horn from Cocoa Beach.
Cool. Okay, Cocoa.
Jerry, you there?
I love Jeannie, by the way, Jerry.
Hi, Jerry. That's Pebble Beach.
No, it was the Cocoa Beach.
Jerry, Cocoa Beach.
Yeah.
I think you know me. I had the heat stroke, and I asked you if I would come out of that. You said yes, eventually I will. So I was encouraged. My brother told me about you about a year ago. I've been listening ever since. You're the real deal. Every time I listen to your show, I learn something. So I went and got a blood test.
All right.
Recently, and they checked all kinds of stuff, and my testosterone was low, and I thought, okay, I need stud mix. And the other thing that I'm concerned about, they said my cholesterol was 136.
Yeah, it's a little too
low.
low.
What do you think about that?
Yeah, I think it's too low. Are you taking a statin for some reason or other? Are you taking something to lower your cholesterol? Are you sure? How old are you, Jerry?
No,
63?
I'm 63.
Okay, because there are many doctors out there, especially cardiologists, that believe in their heart of hearts. Okay, and it's hard to argue with somebody with a strong belief system, whether it's religious or medical. All of my patients take cholesterol-lowering medications called statins because that's what the statistics say we should do, in spite of the fact that really what it does is it supports their livelihood. Who knows about that? But a cholesterol in the 130s is too low. We were not given cholesterol for no reason whatsoever. So there are low levels of things that are every bit as bad as high levels. So too low a blood sugar is dangerous. Too high a blood sugar is dangerous. Too low a potassium, too high a potassium. There's almost nothing in our physiology that isn't a double-edged sword. Too much oxygen toxicity and pulmonary failure. Too little, you die. So what is it about cholesterol? Your body converts cholesterol into another hormone. That hormone has a name, and it's called pregnenolone, sometimes known as the memory hormone. Wouldn't you know? People that are given cholesterol-lowering medications frequently have brain fog. They complain about it. They whine about it. They'll end up with other issues relating to lowering of other hormones, including cortisol, DHEA, could be estrogen, progesterone, testosterone. It lowers all of them. But when you start off with too low cholesterol, all bets are off. So individuals that come in with that circumstance, and I may see somebody with that low of cholesterol, about one person in 200, and they go, well, gee, what do you think of that? Is that great? And I go, no, we're going to need to give you pregnenolone, because if they didn't measure your pregnenolone level, you need to go back to the doc and say, I need a pregnenolone level. A healthy level is between 50 and 100. So you'd end up having to take pregnenolone, DHA, probably progesterone, more than likely cortisol as well. So it's not enough just simply to replace or to support the testosterone with the stud mix. That's great. But you have to be looking at a half a dozen additional hormones, or you're not going to feel all that marvelous. So at 63, you'll push your way through it. In about 6 or 7 years, that lack of pregnenolone, you're going to start feeling really, really stupid and a little bit concerned that you may have something breaking down like Alzheimer's. So we check pregnenolone levels in everybody over the age of 60. And it's shocking what you find. It's the darndest thing. Okay, people coming in with pregnenolone levels in the 20s. So when that happens, we test them. We do a test called a Cognivue, so we can get a baseline cognitive function on folks, so we can then replace the hormone and see if it improves or not. If it does, then it really tells you what you need to do with this person in the future. So these are data points that you have to have if you're going to, let's just say, do stellar in the future as opposed to just eking along. So Jerry, does that answer your question?
Yes, sir. That's great.
Sometimes I feel like I say too much.
Went a little
Actually,
far.
my wife tells me I'd say too much.
But that's a woman.
Yeah.
407-422-1212. That line is open. Text line. Can anything be done for residual itching on your face from shingles?
Oh, shingles. Shingles is
stinks.
terrible.
Yeah,
shingles is one of these sorts of things that's best prevented. That's another inoculation people love to hate.
But you should get it.
But you should get it.
The problem is that a lot of pharmacists won't let you get it unless you have a script if you're under the age of 65, I've been finding.
Yeah, it can happen. You go in there and say, I'm paying cash, all of a sudden they no longer need that prescription.
Yeah,
it's amazing how that works.
All right.
Okay, I'm willing to pay cash. And I'll tell you what, you should be. It's a couple $100, it's worth it, because lifelong pain, is 1 chance in 10 following shingles. Yeah. It is not a lot of fun. Itch is the lowest level of pain. So if you had a potentiometer, in radio language that'd be called a pot. Okay, and you pot it all the way down. It's a potentiometer.
I know what it's called.
You take because you've been in long enough.
Big teacup.
Right. Yeah, big teacup. And so you take it all the way down to 0.5. You'll have an itch instead of a hurt. You rank it all the way up to 10, and you're digging your eyeballs out. So the itch, Okay, you treat that the same way that you would treat any pain at all, believe it or not. So, would you be using narcotics? And the answer is you could, but I wouldn't. So you go ahead and use what are called GABA A agonists. So my preferred one is called baclofen. You take baclofen at bedtime, heavier dose, small dose during the day. And to that, you add another anticonvulsant, and it could be pregabalin, Lyrica is what the brand name is, or gabapentin, Neurontin brand name. And the combination is very, very effective for taking care of that itch, which is really not a histamine issue. So taking antihistamines is a waste of time, money, and actually it will cost you some cognition.
Any topical creams?
Doesn't help. You can be using lidocaine, but you can't really spread that stuff clearly all over your face, not without, giving something up like.
What about
you look like crazy uncle who can't find his mouth with the ice cream cone.
There's nothing wrong with that.
Well, it depends. It's messy.
Save some for extra later.
Whatever. So there's something about Mary.
Yeah, right. Okay, Iggy's watching us on our
Iggy.
Facebook Live
Cool.
feed. He tunes in every week. Stages of Life Medical Institute, just friend us. And then
Ignacio.
tick the old notified so you can tell when we go live in case you forget.
In case I forget.
Iggy says he's got a friend's got endometriosis and they're going for surgery this Friday. Is that normal? Surgery
Is
on
it
a Friday?
normal?
I don't know. Surgery on a Friday is kind of touch and go.
Surgery on a
Don't
Friday?
they normally schedule it? Oh, that's not the question, is
That's
it?
not the question.
Okay, just
okay.
checking.
So, all right. So
we're gonna have to get to that in just a minute. That's
so
why I
hang on
stretched
there,
it.
Iggy.
Hang on, Iggy. Yeah, really, seriously, do doctors do surgery on Fridays?
Oh, absolutely. Yeah. It's
I
just.
thought that was the
But
question.
you better bring your own lunch on being in the hospital Saturday and Sunday.
Yeah. You'll be on your own then. Sort of like an arraignment. Doesn't happen
Oh,
till
yes.
Monday morning. All right. I don't know that. We'll be right back. This is Stages of Life Radio. You want to be a patient? StagesOfLifeMedicalInstitute.com for all kinds of information. We'll be right back. We got a little bit more to handle for you, so I hope you can. That is, handle it, yeah. Oh, gosh.
Why not?
Why not? Yeah, I really thought that was your question, Iggy. Surgery on a Friday.
No, surgery. Okay, as an aside, okay, I started off in general surgery. What you never did, okay, was get operated on in July, especially the first week in July.
Forget about it.
You do not ever do that. You just don't do it.
No,
The
no.
reason is
all your
is
doctors are in Cancun and Madrid.
No, actually, it's because that's when the new interns and residents come in.
Oh gosh.
Okay, that's when things start to go to hell in a handbasket.
Sorry, folks.
So all the new nurses are coming out of school, all the new residents are coming in, all the new doctors are coming in, and what you don't want is new. Okay,
These
you
are
want
tips you
used.
learn.
Okay, you want used doctors. You don't want new doctors. And so the other month that really doesn't work well is December, the end of December, because that's when the senior staff take off and they leave the junior staff to, let's say, you can
for
take
the
the
holidays.
show.
Fend
You
for
know,
the holidays.
you're on for the show. You get to cover. So it was great for the residents because
Yeah.
you got to actually go in there and do stuff without having to worry too much about the attendings telling you how wrong you are. So that's pretty much what it's about. You want to go there when the senior staff is around. So the last week in June, not a bad thing.
No.
But this coming Friday wouldn't have been the date I would have chosen.
That's what I was thinking. First of all, was right out of the gates, the
It's
1st of July.
1st of July. Okay, next.
Oh, Iggy says we're silly.
No, Iggy, that is some really good hard advice.
That was some straight up advice there.
Yeah,
and,
Iggy, that
respectfully.
it doesn't get any better. Yeah, I would try to pushing that up to the first part of the week, not the last part of that week.
Wait, what? Do you think Newt Gingrich, Dennis Prayer, and the others would put their reputation at risk by doing commercials for Title Lock?
No, I think they have to earn a living somehow.
Yeah.
One way or the other. Okay, people have to earn a living. Ronald Reagan, okay, did it for 20 Mule Team Borax, for God's sake. So he was a pretty good president. I think we did okay. Yeah, people do have to earn a living.
Yeah, no. Remember, at a certain point, what was it? The big guy there, was it Raymond Burr? No, the guy that played Raymond Burr. The Ironsides dude.
Well, Raymond Burr was the guy that played.
Yeah, selling frozen peas. I mean, he'd gone from everything to, Rosebud.
that was Orson Welles.
Tried the peas. Yes, but that was the guy I'm talking about. I think he did peas too. Just
okay.
like,
Yeah, well,
you got to pay your bills.
When you're
Orson
in
Welles.
when you're in show business,
Yeah.
okay, and
There
this
you go.
includes politics, okay, sometimes things get a little bit thin and you've got to pay the lights.
What's the difference between power washing and pressure washing?
I think it's the same thing.
I think it's the same thing.
Yeah,
also.
now never turn that on your car, by the way.
Oh my God.
There was a cardiologist who used to live across the street from me. I went out there, and he had this marvelous car, and he had this pressure washer. He's getting ready to clean his car with a pressure washer. He and I had a little talk. It's like, are you out of your
Never
mind?
use a pressure washer on your car
Yeah.
or your body.
Yeah. Oh,
Just-
the body.
yeah.
Oh, okay. Try wearing sandals and using a pressure washer. Okay. Sometimes it runs across your feet.
Yeah, not good. Welcome back to the show with helpful hints from Heloise.
Heloise.
What the hey?
Whatever happened to Heloise? I think she passed away.
She probably
in the
did.
1970s.
Helpful hint.
Helpful.
Yes, anyway. This is Stages of Life Radio. We're talking medical stuff right now. Yeah. We started out talking about the males. Because, guys, you guys just don't get as much love as you deserve. Because women are always like the squeaky wheel. Oh, this
Well,
hurts. This is swollen. Don't touch that. Ew, it looks gooey.
Yeah, well, the average doctor sees twice as many female patients as male.
But that's because you guys are either earning the bread or you're stubborn and you won't go to the doctors.
And could be a little bit of both, couldn't
Yeah,
it?
exactly.
Yeah, who the heck wants to go? I have to go to the doctor.
Well, you are the doctor.
I am
There's
the
a
doctor.
slight difference.
Yeah, I mean, but it took me about a year and a half to get a little biopsy taken off this thing off my chest. Okay, Tess finally made the arrangements for me, and I wouldn't have, had it not
See,
been for
this-
her making the arrangements, I wouldn't have gone either.
This is the bullheadedness I speak of.
It's what it is.
Speaking
okay?
of bullheads, we got Rick. Hi, Rick. Rick is checking in from Altamonte Springs. He's 74. Hey, Rick, cholesterol, 198. Triglycerides, 82.
Good for you. That's right where you want them, bro.
Yeah.
So what's up?
Well, the VLDL 15, but the LDL is 115.
Don't
The
care.
rates are 1.7.
Couldn't care less. And I'll tell you why I don't
the
care.
good one?
No, it's fine. Okay, there's a problem. Okay, with the LDL calculations. When you take a look and you add everything up, it doesn't necessarily make any sense at all. So I'm having the same problem in my own lab. I see it in the large labs who I will not mention, but they're all coming back high. So I suspect there's something wrong with the assays. The long and short of it is if you can get your total cholesterol under 200, it really doesn't make a great deal of difference. You say, well, what about particle size? Particle size doesn't make any difference unless you have elevated cholesterol, because then it tells you what the situation is. But the joke is there's still nothing you can really do about it. So if your LDL is a little bit high, okay, truly, if it's a little bit high, what are we going to do? Start you on Crestor? Heck no.
Ooh.
No.
No.
Okay, so what would you do? Cut back in your nuts and cheese. That will help. But for the most part, having your particular numbers tells me that LDL is probably wrong. Having a triglycerides in the 80s is like the holy grail. That is the best thing going, because the triglycerides are far more important cardiovascularly than any component of the cholesterol. So I will disagree with the other docs that are listening in. It doesn't really matter. The fact of the matter
Also,
is
blood pressure 137 over 71.
that's pretty
good.
decent too. Yeah, I mean, it'd be nice if the systolic were just a little bit lower, but you know something? You can do that with hibiscus tea. All right, hibiscus tea. You can buy it for $9 a pound on Amazon. You make your own tea out of this stuff, and it lowers your blood pressure. Do you necessarily need to be taking a calcium channel blocker, an ARB, or an ACE inhibitor? No, you can do it with hibiscus tea in that that bracket. So you
Is
are
that better than the Tylenol?
you are to be congratulated. Okay, how's that?
That's good.
Yeah, all right. Even if you live in Altamont Springs, you're doing all right.
Well,
If that doesn't raise your blood pressure these
Oh,
days.
Rick. Thanks, man. Appreciate you checking in today. 407-422-1212. Got a little bit left here
He's
time-wise.
taking care of
Yeah.
himself.
By the way, Iggy said we were making fun of the endometriosis. Is it surgery actually normal, aside from not doing it on a Friday?
Is it something that might be necessary is really the question. The answer is it can be. My wife had endometriosis. Turned out that it was very, very necessary. And the surgeons don't like operating on folks with endometriosis in particular, because it's very hard to get it all anyway. So by the time that you're going in for surgery for this, things are really out of hand.
Yeah, so
So
the
the answer is
surgery's
more than
necessary,
likely
yes.
it is, yes.
So
And
there you
it's
go.
gentler on the system than taking medications like Lupron, which shut everything down.
Boy, this person's really onto this Tidal home locked thing.
That's okay. Everybody has an opinion.
Why does Tidal Lock run commercials with a crook claiming to have stolen over 100 home titles?
Well, because actually, why did they interview Willie Sutton as to why he robbed banks?
Right.
Okay, and their answer was because that's where the money's
That's
at.
how you learn, too, from the criminals.
You learn from them. You ask them, how did you do it? And then you try to fix it. The fact
reverse
is
engineering,
that
my friend.
you can, in fact, choose not to buy the product. Okay, I haven't bought it. Okay, I'm thinking about it, but I haven't. I'll probably wait until somebody hacks my stuff, and then I'll do it after the fact. But, yeah. Everybody has a choice. That's the beauty in life. You have the choice to do the right thing, and you have the choice to do the wrong thing. The joke is you don't always know which is right and which is wrong.
Exactly.
Okay? So what's the motivator? Call to action? So you have a product that fixes a problem, which may or may not be your problem, or may not ever be your problem. But if it ever became your problem, you'd be kicking yourself for not spending the $10 a month to fix it. That's what I think.
Dr. Klein, I have a 269 cholesterol and low testosterone. I'm taking high doses of nanocurcumin for my retina problem. Thank you.
Okay, so what do you want to do to lower your cholesterol? There are a couple things that you can do. First thing you want to find out is whether you're hypothyroid. The number one cause for elevations in cholesterol is borderline hypothyroidism to profound hypothyroidism. So you want to go not only check your TSH, which has probably already been done. Well, my TSH is normal. It doesn't tell you anything. Okay? So you need to know your T3, T4, TPA, ATG, free T3, free T4, and it's nice to know your T uptake.
You need to go to Klein.
You just need to go to somebody that's actually going to look at the whole thing. Because if you can lower the cholesterol by taking thyroid medication, which is what was done in the 1950s, 1960s, then that's what you would do now. But by giving somebody a cholesterol-lowering medication, if the cholesterol going up is a result of something that's making the liver not work right, you are missing a very interesting opportunity. So what do I think? Don't go with a knee-jerk. Well, we need to do something to lower cholesterol. How about let's do something diagnostically to find out why the cholesterol is elevated? Find out why the liver is crying. When the liver cries, cholesterol goes up. When the pancreas cries, triglycerides go up. They're not the same thing. We do order them both in lipid panels, but they're not caused by the same issues.
I see.
One's typically dietary, the other one is typically metabolic. So when you're looking at a situation like that, you have to dig deeper. So what can make the thyroid not work right? Oddly enough, if you don't have enough progesterone on board, not enough testosterone on board, it won't work. So all of these hormones work together very much like, in fact, like a basketball team. Okay, each player has a position. Each one works with the others. Sometimes they're interchangeable, but rarely. But they're always passing the balls back and forth. So many of these hormones convert into each other, but they're all necessary in balance for you to have a winning team. Mm-hmm. And so what do you have if you don't have a winning team? You have a losing team.
Oh.
Okay, there's no such thing as a winner, across the board. You've got to have it all, every bit of it.
If you want to be a patient of Dr. David Klein's, we suggest it because he keeps people healthy. If you've got problems and they're just throwing medicine at you, maybe you should get it solved.
Yeah, well, the trick is diagnostics, figuring out what's wrong. If you can't figure out what's wrong, you are hopeless and you're not going to do well. If you would like to come in, we're still accepting patients. You can reach us at 407-679-3337, stagesoflife.com.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts most insurance and Medicare too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.